What if I told you that the medication your doctor prescribed to help you sleep better is actually stealing your memories? Right now, millions of Americans over 60 are taking medications that significantly increase their risk of dementia and Alzheimer's disease. And here's the most alarming part. Many doctors either do not know about these risks, or they simply do not have time to discuss them during a 15-minute appointment. Barbara was 71 when she started forgetting her grandchildren's names. Her family thought it was just normal aging, but when a pharmacist reviewed her medications, they discovered she was taking 3 different drugs known to cause cognitive decline. Within months of stopping them, her memory started coming back. If you or someone you love takes multiple medications daily, the next few minutes could protect your brain and preserve your independence. Please stay with me. Hello and welcome back. If you are new here, I'm dedicated to bringing you critical health information that can actually change lives, especially for those of us over 60. Today, we are tackling a subject that frankly makes me angry. Not at doctors. They are doing their best in an overwhelmed healthcare system, but at a system that allows seniors to take brain-damaging medications without proper warnings or alternatives. We are going to discuss 9 classes of medications that research has clearly linked to increased dementia risk, memory problems, and cognitive decline in older adults. These are not rare medications. These are pills sitting in medicine cabinets across America right now. According to a groundbreaking study published in JAMA Internal Medicine, certain medications increase dementia risk by up to 54% when taken long-term. 54%! That is a life-changing statistic. But here's the good news. Knowledge is power. Once you understand which medications pose risks, you can have informed conversations with your doctor about safer alternatives. In many cases, there are better options that will not put your brain health at risk. Let us dive into these 9 medication categories. I will explain what they are, why they are prescribed, how they affect your brain, and most importantly, what you can do about it. The first and perhaps most dangerous category is anticholinergic medications. That is a big word, so let me break it down simply. These medications block a chemical in your brain called acetylcholine. This chemical is absolutely critical for memory, learning, and attention. When you block it, your brain literally cannot function properly. The scary part? Anticholinergics are everywhere. They are used to treat allergies, sleep problems, overactive bladder, depression, and many other conditions. Common examples include diphenhydramine, sold as Benadryl and found in many sleep aids like Tylenol PM, doxylamine found in NyQuil and Unisom, oxybutynin and tolterodine for overactive bladder, older antidepressants like amitriptyline, and medications for vertigo like meclizine. A landmark study from the University of Washington followed over 3,000 adults aged 65 and older for more than 7 years. The researchers found that people who took anticholinergic medications regularly had a 54% higher risk of developing dementia compared to those who did not. Even more concerning, the effects appear to be cumulative. The longer you take these medications, and the higher the dose, the greater your risk. Remember that chemical acetylcholine I mentioned? It is essential for memory. When scientists study Alzheimer's brains, they find dramatically reduced levels of acetylcholine. So taking medications that block this chemical is literally mimicking what happens in Alzheimer's disease. Think about that for a moment. We are taking medications that create the same brain chemistry as dementia. If you are taking any anticholinergic medication, do not panic, and do not stop suddenly. Instead, schedule an appointment with your doctor to discuss alternatives. For allergies, newer antihistamines like Claritin or Zyrtec do not cross into the brain as easily. For sleep, cognitive behavioral therapy works better than any pill and has 0 dementia risk. For overactive bladder, pelvic floor exercises and bladder training can be remarkably effective. The key is asking your doctor, is there a safer alternative that will not affect my brain? The second category is benzodiazepines, commonly prescribed for anxiety, insomnia, and muscle tension. You probably know these medications by their brand names: Xanax, Ativan, Valium, Klonopin, and Restoril. These medications work by calming your brain and nervous system. They are incredibly effective for anxiety. That is exactly why they are so widely prescribed and why they are so hard to stop taking. But here is what many seniors do not realize. Benzodiazepines are meant for short-term use only, usually 2 to 4 weeks maximum. Yet millions of older adults have been taking them daily for years, even decades. A comprehensive study published in the British Medical Journal examined data from nearly 2,000 dementia cases. The researchers found that that people who had taken benzodiazepines for more than 3 months had up to a 51% increased risk of dementia. Benzodiazepines suppress activity in the hippocampus. That is the part of your brain responsible for forming new memories and learning. With chronic use, this suppression can become permanent. The brain literally shrinks in certain areas, and those changes may not reverse even after stopping the medication. Additionally, benzodiazepines increase fall risk dramatically, and we know that head injuries from falls are a major risk factor for dementia. Watch for these warning signs: increasing forgetfulness while on these medications, feeling foggy or disconnected, difficulty learning new information, increased confusion, especially in the morning, and balance problems or near falls. Never stop benzodiazepines suddenly. This can cause dangerous withdrawal symptoms, including seizures. You absolutely must work with your doctor to taper off slowly, sometimes over many months. Ask your doctor about safer alternatives. Cognitive behavioral therapy for anxiety, meditation and mindfulness practices, regular exercise, which is remarkably effective for anxiety, or SSRI antidepressants, which have a much better safety profile for long-term use. Number 3 on our list might surprise you: proton pump inhibitors, or PPIs. These are medications for acid reflux and heartburn, sold as Prilosec, Nexium, Prevacid, and Protonix. They're among the most commonly prescribed medications for seniors. Many people take them for years without realizing the risks. PPIs work by dramatically reducing stomach acid production. They are very effective for healing ulcers and managing severe reflux. The problem? They were designed for short-term use, 8 to 12 weeks maximum, but millions of people take them indefinitely. Multiple studies have now linked long-term PPI use to increased dementia risk. A German study of nearly 74,000 participants found that regular PPI users had a 44% increased risk of dementia. Scientists are not completely certain how this happens, but there are several concerning mechanisms. First, PPIs reduce your body's ability to absorb vitamin B12. B12 is absolutely critical for brain health. B12 deficiency causes symptoms that look exactly like dementia: memory loss, confusion, and difficulty concentrating. Second, by reducing stomach acid, PPIs may increase the accumulation of beta-amyloid plaques in the brain. Those are the same plaques found in Alzheimer's disease. If you have been on a PPI for more than a few months, talk to your doctor about whether you still need it. Many people can successfully transition to H2 blockers like famotidine, which have a better safety profile, or lifestyle changes like smaller meals, avoiding trigger foods, and not lying down after eating. Here is something important: you cannot just stop PPIs suddenly because of rebound acid production. Work with your doctor on a gradual tapering plan. Number 4 is controversial: statins, the cholesterol-lowering medications. Before anyone panics, let me be clear: statins save lives. For people who have had heart attacks or strokes, statins are absolutely essential. But for otherwise healthy seniors taking them just in case, the risk-benefit calculation may be different. Common statins include Lipitor, Zocor, Crestor, and Pravachol. The connection between statins and cognitive problems is complicated. Some studies show increased dementia risk, while others show no effect or even protection. What we do know for certain is that many people experience memory problems while taking statins. Your brain is about 25% cholesterol. Cholesterol is essential for memory formation and brain cell communication. Some researchers believe that aggressively lowering cholesterol, especially in older adults whose brain is already vulnerable, may interfere with normal brain function. If you are taking statins and experiencing memory problems, talk to your doctor. Do not stop on your own, especially if you have heart disease. Ask if your statin dose can be reduced. Request a different statin, as some affect the brain more than others. Consider supplementing with CoQ10 with your doctor's approval, and focus on lifestyle approaches like the Mediterranean diet, exercise, and stress reduction. I want to pause here for just a moment. If you are over 60, or if you are caring for an elderly parent or loved one, this information could literally preserve someone's independence and quality of life. Dementia does not just affect memory. It affects dignity, relationships, and the ability to live independently. If we can prevent even a portion of dementia cases by being smarter about medications, that is worth paying attention to. If you are finding this information valuable, please subscribe to this channel and hit that bell icon. We publish well-researched, practical health content for seniors every single week. And please share this video with anyone you know who takes multiple medications. Your engagement helps us reach more people who need this information. Now, let us continue with medication number 5. Number 5 brings us back to antihistamines, but this time we are talking specifically about first-generation antihistamines. These are the older allergy and cold medications that make you drowsy: diphenhydramine, chlorpheniramine, and hydroxyzine. These overlap with the anticholinergic medications we discussed earlier, but they are so commonly used that they deserve their own mention. Here is what concerns me most. Many seniors take these medications daily without realizing they are not meant for long-term use. You might be taking them for seasonal allergies, sleep problems, itching from skin conditions, or cold and flu symptoms. A study from the University of Washington that tracks seniors for over a decade found that taking just one anticholinergic antihistamine daily for 3 years increased dementia risk by 54%. These medications do not just make you drowsy, they are actively blocking the brain chemicals you need for memory and thinking, and the effects build up over time. Think of it like this: if you took a small amount of poison every day, it might not make you immediately sick, but over years, the accumulated damage could be devastating. That is what is happening with these medications and your brain. Safer alternatives exist. Second-generation antihistamines like Claritin, Zyrtec, and Allegra do not cross into the brain as readily. For sleep, consider melatonin, magnesium, or sleep hygiene improvements. For itching, try topical creams or moisturizers. For allergies, nasal steroid sprays are highly effective and much safer. If you are using Benadryl or similar medications regularly, it is time for a conversation with your doctor about safer options. Number 6. Medications for overactive bladder and urinary incontinence. This is a sensitive topic, but it is important. Bladder control issues affect many seniors. They can be embarrassing and isolating. So when a medication promises relief, it is very tempting to take it. The most commonly prescribed medications include Ditropan, Detrol, Vesicare, and Enablex. Unfortunately, these medications work by blocking acetylcholine. Yes, that same brain chemical critical for memory. They are anticholinergics, which we have already established are dangerous for brain health. The cruel irony is that these medications are prescribed precisely when people are most vulnerable, in their 60s, 70s, and 80s, when brain health is already at risk. Research published in JAMA Internal Medicine found that seniors taking these bladder medications had significantly higher rates of cognitive decline and dementia. The good news is that non-drug approaches work remarkably well for bladder control. Pelvic floor physical therapy is incredibly effective and underutilized. Bladder training exercises and scheduled bathroom trips help tremendously. Dietary changes like reducing caffeine and alcohol make a big difference. Weight loss and managing underlying conditions like diabetes also help. If medication is absolutely necessary, ask your doctor about Myrbetriq. It works differently and does not have the same cognitive risks. Or discuss topical estrogen for women with doctor approval. Your bladder health is important, but not at the cost of your brain health. There are solutions that protect both. Number 7. Certain antidepressants, specifically the older tricyclic antidepressants. Depression is serious and absolutely deserves treatment. I am not suggesting anyone suffer with untreated depression, but not all antidepressants are created equal in terms of brain safety. The problematic ones are older tricyclic antidepressants like amitriptyline, doxepine, imipramine, and nortriptyline. These medications were developed in the 1950s and 60s. They work, but they also have strong anticholinergic effects, meaning they block those critical brain chemicals we keep talking about. Doctors sometimes prescribe these for chronic pain, migraines, or sleep problems rather than depression. But regardless of why you are taking them, the brain risks are the same. Studies have consistently shown that anticholinergic antidepressants increase dementia risk. The risk increases with longer use and higher doses. Modern antidepressants like SSRIs and SNRIs do not have the same anticholinergic effects. They are generally much safer for brain health in older adults. For chronic pain, duloxetine is an SNRI that is FDA approved for several pain conditions and does not carry dementia risk. For sleep, we have already discussed better options than tricyclics. For migraines, there are many newer preventive medications available. Never stop antidepressants abruptly. Work with your doctor to transition to a safer alternative if appropriate. Depression itself is a risk factor for dementia, so staying mentally healthy is crucial. Number 8. Certain anti-seizure medications, also called anticonvulsants. These medications are prescribed not just for epilepsy, but also for nerve pain, migraines, mood disorders, and other conditions. The ones of most concern for cognitive function include phenobarbital, phenytoin, carbamazepine, topiramate, and gabapentin in high doses. If you have epilepsy, preventing seizures is absolutely critical and takes priority. clarity. Seizures themselves damage the brain, so you need effective control. But if you are taking these medications for other reasons, like nerve pain, migraines, or mood, it is worth discussing with your doctor whether the benefits outweigh the cognitive risks. These medications slow down brain activity to prevent seizures, but that slowing does not just affect seizure centers. It can affect memory, thinking speed, and mental clarity. Many people on these medications describe feeling like they are in a fog or thinking through cotton. Over time, this can contribute to permanent cognitive changes. For nerve pain, ask about duloxetine, topical lidocaine patches, or physical therapy. For migraines, discuss newer CGRP inhibitors or lifestyle modifications. For mood disorders, explore modern mood stabilizers with better cognitive profiles. If you must stay on an anti-seizure medication, work with your doctor to use the lowest effective dose and consider cognitive exercises to maintain brain function. Number 9. Corticosteroids, when used long-term at high doses. These are powerful anti-inflammatory medications like prednisone, methylprednisolone, and dexamethasone. They are prescribed for severe arthritis, COPD, asthma, autoimmune diseases, and many other inflammatory conditions. Short-term use of steroids for acute problems is generally fine. The concern is with long-term use, months or years at significant doses. Long-term steroid use can shrink the hippocampus, the memory center of your brain. It interferes with neurotransmitter balance. It reduces brain volume over time, and it can cause psychiatric symptoms including confusion and memory problems. Studies have shown that people on long-term corticosteroids perform worse on memory tests and have structural changes in their brains visible on MRI scans. If you are on long-term steroids, you are probably taking them for a serious condition that requires treatment. The goal is not to stop the steroids without medical supervision. That can be dangerous. Instead, discuss with your doctor if the dose can be reduced to the minimum effective amount. Ask if there are steroid-sparing medications that could reduce your steroid need. Consider switching from daily to alternate day dosing, and explore non-steroidal treatment options for your condition. For conditions like rheumatoid arthritis, newer biologic medications often allow significant steroid reduction. For asthma and COPD, optimizing inhaled medications can sometimes reduce the need for oral steroids. The key is working with a specialist who understands both your underlying condition and the importance of minimizing steroid exposure for your brain health. Now that we have covered these 9 medication categories, I want to address the elephant in the room: polypharmacy. That is the medical term for taking multiple medications at once, and it is incredibly common among seniors. The average person over 65 takes 4 to 5 prescription medications daily, plus over-the-counter drugs and supplements. Here is what research shows: the more medications you take, the higher your risk of cognitive problems, even if none of the individual medications are on our list of 9. Why? Because medications interact with each other in complex ways. Your liver and kidneys, which process medications, work less efficiently as you age. Drugs can build up to higher levels than intended. Side effects multiply. Schedule a comprehensive medication review with your doctor or pharmacist at least once a year. Bring every single thing you take: prescriptions, over-the-counter drugs, vitamins, supplements, herbal remedies. Ask these critical questions. Am I still taking this for the right reason, or is it left over from an old problem? Are any of these medications treating side effects of other medications? What is the minimum number of medications I actually need? Are there any medications I could safely stop or reduce? Are any of these known to affect memory or thinking? Many seniors discover they are taking medications they no longer need, or that safer alternatives exist. There is a concept in geriatric medicine called deprescribing. It is the systematic process of reducing medications that may be causing more harm than good. It is becoming increasingly recognized as essential for senior health. Beyond medication management, let us talk about positive steps you can take today to protect your brain and reduce dementia risk. Exercise regularly. This is the single most powerful thing you can do for your brain. Exercise increases blood flow, promotes the growth of new brain cells, and reduces inflammation. Aim for 30 minutes of moderate activity most days. Walking counts. Follow a brain-healthy diet. The Mediterranean diet and MIND diet have the strongest evidence for reducing dementia risk. Focus on vegetables, berries, nuts, whole grains, fish, and olive oil. Limit red meat, butter, cheese, and sweets. Stay socially connected. Loneliness and isolation are major risk factors for dementia. Regular social interaction keeps your brain engaged and active. Join clubs, volunteer, stay in touch with family and friends. Challenge your brain. Learn new things. Take classes. Do puzzles. Learn a language or musical instrument. The key is novelty. Doing new things that challenge you, not just repeating familiar activities. Manage cardiovascular risk factors. What is good for your heart is good for your brain. Control blood pressure, blood sugar, and cholesterol. Do not smoke. Get quality sleep. Poor sleep is linked to increased dementia risk. Your brain clears out toxic proteins during deep sleep. Most seniors need 7 to 8 hours per night. Manage stress. Chronic stress damages the brain. Find healthy ways to relax. Meditation, prayer, time in nature, hobbies you enjoy. Protect your head. Traumatic brain injuries increase dementia risk. Prevent falls by removing trip hazards at home, using assistive devices when needed, and addressing balance problems. Stay on top of hearing and vision. Untreated hearing loss is a major dementia risk factor. Get your hearing checked and use hearing aids if needed. Same with vision. Get regular eye exams. Keep regular medical appointments. Many conditions that affect the brain, like vitamin deficiencies, thyroid problems, and depression, are treatable if caught early. Remember, it is never too late to start protecting your brain. Even small changes can make a significant difference. Let us bring this all together. We have covered 9 categories of medications that research has linked to increased dementia risk. Anticholinergic medications, benzodiazepines, proton pump inhibitors, statins in certain situations, first-generation antihistamines, overactive bladder medications, older tricyclic antidepressants, certain anti-seizure medications, and long-term high-dose corticosteroids. The point of this video is not to scare you, or to suggest you should stop taking medications your doctor has prescribed. These medications exist because they treat real problems that genuinely need treatment. The point is to empower you with knowledge, so you can have informed conversations with your healthcare providers about the safest possible treatments for your specific situation. In many cases, there are alternatives with better safety profiles. In other cases, lifestyle approaches can reduce or eliminate the need for certain medications. And sometimes, the benefit of a medication truly does outweigh the risks, and continuing it is the right choice. But you deserve to make that decision with full information, not in the dark. Your brain health is precious. Your memories, your personality, your ability to live independently. These are things worth protecting. I want you to walk away from this video with 3 action steps. First, make a list of every medication, supplement, and over-the-counter drug you take regularly. Second, schedule an appointment with your doctor specifically to review your medications. Do not try to squeeze this into an appointment about something else. This deserves dedicated time. Third, ask about safer alternatives for any medications on today's list. Come prepared with questions. Bring a family member if that helps you remember and advocate for yourself. Remember, you are the most important member of your healthcare team. Your doctors have expertise, but you know your body and your priorities. Partnership between you and your healthcare providers creates the best outcomes. Your future self, the one who still remembers grandchildren's names, who can balance the checkbook, who can live independently, will thank you for taking action today. If you found this video helpful, please give it a thumbs up and subscribe to this channel. We publish evidence-based health information for seniors every single week. Information that can genuinely improve your quality of life and protect your independence. Hit that bell icon so you are notified when new videos come out. Your brain health is too important to leave to chance. And here is the most important thing. Share this video with anyone you know who takes multiple medications. Share it with your spouse, your siblings, your friends, your neighbors, your adult children who care about your health. This information could prevent dementia in someone you love. It could preserve someone's independence. It could give families more precious years together. Drop a comment below and let me know. Were you surprised by any of the medications on this list? Are you planning to talk to your doctor about your medications? What concerns do you have? I read every comment, and your experiences help other viewers know they are not alone. Thank you so much for watching, for caring about your brain health, and for being proactive about your future. You deserve to live your best life at every age with a sharp mind and clear memories. Take care of that beautiful brain of yours. I will see you in the next video.